Gracias.
Buen día, Claudia. Bueno, ya estamos todos, entonces, eh, al menos a diferencia de ayer, ya me conocen los que no me conocían, así que bienvenidos y bienvenidas a la segunda clase del módulo 3 de la diplomatura. Hoy está con nosotros Mariam Jashi, así que bueno, voy a tener ahora el gusto de presentarla y eh, ella estará en el primer segmento de la clase y luego de una pausa tendremos a Eleonor Silva en la segunda parte de la clase. Así que eso va a ser hoy nuestra clase de 10 a 1. Eh, bueno, en principio contarles que Mariam Jashi se está conectando desde muy lejos, desde Berlín. Así que bueno, nada, muchas gracias Mariam por conectarte sábado por la tarde allá en Europa. Mariam trabaja con Unite desde hace muchos años. Es una formuladora de políticas de alto nivel en salud global, desarrollo sostenible y financiamiento innovador, y tiene experiencia en 26 países de Europa, Asia, África y Medio Oriente. En la actualidad, Mariam es CEO de la Global Sepsis Alliance, hace poquito, y ella integra asimismo hace muchos años la Junta Directiva de la red Unite, de ahí la conozco yo. Es también Mariam, Secretaria General de la Asociación Internacional de Mujeres Médicas y es presidenta de la Junta Asesora de la Academia Médica de Tbilisi en Georgia. Bueno, Mariam fue miembro del Parlamento en Georgia, fue presidenta del Comité Parlamentario, viceministra de Salud en su país y presidenta de la Secretaría del Grupo Líder sobre Financiamiento Innovador. Y trabaja en temas de financiamiento sostenible y financiamiento en salud hace muchos años. Su experiencia incluye 12 años de trabajo humanitario y de desarrollo con UNICEF y ONU-SIDA, además de otras agencias de la ONU, Gavi y el Banco Mundial. Recibió el premio de la OMS por su contribución a la erradicación de la poliomielitis en Europa. Es Mason Fellow de Harvard Kennedy School, tiene una maestría en Administración Pública de la Universidad de Harvard, un título de médica de la Escuela de Medicina y una maestría en Salud Pública de la Universidad Estatal de Tbilisi. Así que bueno, Mariam es una súper experta en temas de salud global y a mí me da un gusto enorme tenerla hoy acá en nuestra clase para este módulo que sabemos que para ustedes algunos ya vienen trabajando en las comisiones de salud de sus parlamentos como parlamentarios o como staff, pero creo que bueno, Mariam nos va a poder hoy ofrecer una mirada de cómo se trabajan estos temas alrededor del mundo. Así que bueno, nada, bienvenida Mariam y adelante con tu presentación.
Thank you, Anna, so much for your kind introduction. And it's a pleasure to join the Austral University once again for this excellent initiative of raising awareness and discussing the global health issues with the parliamentarians and decision makers from the Latin American region. I wish we could expand this excellent initiative to other regions, and I believe we can discuss this further within the Unite board. So Anna has already made the introduction, so I'll not definitely stop on my current positions. I will be today sharing a brief presentation about the basics of global health, its importance, success stories in global health that we have, remaining challenges, the latest 2023 UN high-level meetings on universal health coverage and the pandemic accord that might be interesting for engagement of our esteemed members of parliament, the role of parliamentarians in moving forward with the global health agenda, and we'll have also practical discussions at the end of the presentation. So let's start with the basic question. What is global health? Global health, by its classical definition, is the intersection of study, research, and practice, both from public health to clinical medicine, to improve health for all people globally. And if you will recall our very latest experience with the pandemic, you will identify all the key characteristics of the global health. So the global health related issues carry global vision, goals, and solutions. They can strengthen both national and international health systems. The global health includes both population-wide as well as individual clinical interventions. It's beyond the border approach, so not any country, none of the single countries can actually tackle the global health challenges. It is beyond the health multisectoral approach towards the well-being and safety of our population. Global health programs and initiatives usually have common monitoring and reporting mechanisms and enhances health and global security, as well as promotes international partnerships for common goals. And once again, if we visualize each of the definition in regards to the latest COVID-19 pandemic, the latest experience has demonstrated both the magnitude, multisectorality, multiplicity of the global health threats, and the need for integrated and coherent approach for solving the problem, both for individual countries and internationally. Why global health matters, why it is important? First of all, as the policymakers and as the parliamentarians, we have to recall that health is a basic fundamental human right. And the highest attainable standard of health is defined as a fundamental right based on the WHO Constitution. The Universal Declaration of Human Rights back in 1948 also identified health as part of the right to adequate standard of living, and the subsequent international covenants on economic, social, and cultural rights, as well as Convention on the Rights of the Child in 1989, has formed the very comprehensive foundation to the global health and health as the human right. Of course, we have a long list of international conventions, pacts, declarations, but those 4 documents does provide the very basics that any policymaker, any politician can refer to. The second reason why global health is important is that, unfortunately, despite the progress made in medicine and global health, we still witness every year enormous toll of deaths and disability. Every year we have over 55 million deaths. 1.3 people are living with disability, 1 in every 6 person. And as Anna mentioned, I just joined the Global Sepsis Alliance, and I think it's time for us to also improve the awareness that every year 50 million people are affected by sepsis. That is the common pathways to death from infectious, non-infectious diseases and injuries. And sepsis takes every year more than 30 million lives of children and adults, more than we have lost during the tragedy of the pandemic. And here are the individual statistics for the different disease factors, with ischemic heart diseases, stroke, and chronic obstructive pulmonary diseases definitely leading the top 10 causes of death. And each of the area takes millions of lives every year. But most importantly, why global health matters and why decisions and evidence-based policies are important is that out of these 55 million deaths, we can prevent a significant part of mortality. For example, with the right decisions and evidence-based policies, we can save millions of lives and prevent. I know what happened. I cannot change the slide. Second. Unfortunately, there's a technical problem apparently on the slide, but I will try to continue. So with the right...
Could you, Mariam, or you want?
Would you be able to open the presentation from your source? Because
would you like yeah.
If you could, if you don't mind. Meantime, I will continue our discussion. So, as mentioned, with the right policies and evidence-based decisions in the parliaments and governments, we can save at least 90% of cardiovascular diseases, prevent at least 4 million deaths of children. Maybe this way it's more, okay, second. Yeah. Thank you, Anna.
Dear Mariam, no.
Yes. So, next slide, please. Next slide. Yeah. And we have the listing of the different diseases that we can prevent. If you could, no? Okay, that's perfect. Thank you. So we can prevent at least 90% of heart diseases, that is the leading cause of deaths as non-communicable diseases, prevent more than 3 million injuries every year with the right safe traffic and road policies, prevent 80% of lung cancer through early identification and tobacco regulations. We can also prevent over 500,000 newborn deaths through vaccination and safety delivery practices. And again, 1/3 of the 13 million sepsis-related deaths in hospitals can be prevented with very simple training and capacity building policies. Next slide, please, Anna. Mm-hmm. And of course, the last and definitely not the least, global health is closely interlinked to global security and development issues, and no one nation can stand alone in the fight against infectious diseases, starting from Spanish flu 100 years ago to HIV/AIDS pandemic, COVID, sepsis. Global health threats can disrupt global economies, and we have witnessed that a couple of years ago. The pandemic increased poverty and unemployment and further increased sustainability of socially vulnerable groups. And most importantly, the pandemics has not only affected the health systems, but it affected democracy and human rights. And we've seen that during the COVID-19 in more than 80 countries, because of the decisions taken by the governments, sometimes not evidence-based, the status of democracy and human rights has worsened in 80 countries based on the Freedom House report. Next slide, please, Anna. Of course, we have a number of success stories that we're extremely proud of in global health. And the most famous success story starts with Sir Alexander Fleming with his discovery of penicillin, the antibiotic, in 1928, that till today, from 1941, has saved more than 200 million lives. So that is the magnitude of the global health innovation and one single successful intervention. We also have additional success stories from more contemporary period of global health. And Anna, if we can move to the next slide, please. Please. For example, in the 20th century, the biggest achievement of the global health and WHO was eradication of smallpox, that has saved 150 to 200 million lives. Every year, vaccination, the basic immunization, saves 4 million child deaths. AIDS-related mortality was reduced by 68% with the modern antiretroviral drugs that are also much more affordable than they were 10 or 15 years ago. And malaria deaths have been also reduced from over 800 to 558,000 annually. Can we move to next slide, Anna? So.
Let me check. And it's like there.
Okay.
No, wait. Is it okay? Yeah.
Yes, it's fine. Thank you. As many of you have heard the universal health coverage, even if you are not medical doctors or public health experts, universal health coverage has been discussed by the WHO and now at the United Nations level. And universal health coverage is to reach every person everywhere with the basic package of health services, including maternal and child health interventions, immunization, prevention of cardiovascular diseases, infectious disease portfolio, and also, when needed, hospital services. Based on the latest report from the World Health Organization in 2023, we have seen from 2000 to 2021, over the 21 period, substantial increase from the coverage of the basic universal health services from 45% of the index to 68%. Unfortunately, you will see that the progress was stalled during the COVID and has not improved from the 2019 when the pandemic hit. But still, this is an extremely important success story that we are all proud of. Next slide. So in terms of the success stories, what has worked? Usually, when the global health issue addresses a policy or intervention that can prevent millions of lives or improve the health status of billions of populations, high-level political dialogue and commitment is extremely important. What we have seen over the last 20 years is that UN resolutions and declarations, especially the 8 Millennium Development Goals that are listed on the left of our slide, and now the 17 interrelated Sustainable Development Goals for SDGs have played the critical role in consolidating political commitment and bringing together the global development community around commonly agreed goals. As you have seen from the Millennium Development Goals that were approved for 2000 to 2015 period included 8 goals, and 3 of them were related to reducing child mortality, improving maternal health, and combating HIV, TB, and malaria. And that's where we have seen the most of the success in the UN Development Agenda. The new SDGs that include 17 goals specifically includes the good health and well-being as the 3rd goal. And if you go into the description of the goal, you will find all the specific targets. But the new agenda of the UN is structured so that each of the goals are interrelated. For example, health is also integrated into the poverty reduction, number 1. It's also related to healthy cities and sustainable cities and communities, or climate action. So I very much recommend you to explore the SDG 3, like 3rd goal of the Sustainable Development Agenda, for further details and the basic messages that you might find helpful. Next, what has worked is that in addition to the high-level political dialogue and commitment, investments have been critical. And if we go to the next slide, we will see that the global community, if we can click on it a couple of times, yeah. The global community, while seeing these major improvements in the immunization, HIV, tuberculosis, or malaria programs, they have ensured substantial financial investments and earmarking of global resources. I'm sure most of you have heard about the Gavi Alliance or the Global Fund or the GAIN. UNITAID is also an initiative where Brazil, for example, joined France and other European countries and established innovative financing mechanism for supporting infectious disease treatment for HIV, TB, and malaria. And that's a wonderful example of how a global community can collaborate. Investment in research and development through discovering new and effective tests, therapies, and prevention commodities are extremely important. And for example, the progress with hepatitis C, that hepatitis C is already not a fatal disease and it can be treated in over 96% of cases, was possible through the discovery of new antiretroviral drugs. And finally, international monitoring mechanisms, accountability metrics. When we agree on the global agenda for health, we have to measure our progress. And that's why we have the annual reports, health matrices, and UN accountability mechanisms. And even though those seem to be the international health-related issues, each of the policymakers in the countries, each parliamentarian can keep the respective governments and also international organizations accountable for the commitments we have given. Next slide, Anna. Despite progress, unfortunately, this is not a complete list of problems that the global community faces till today. Almost 300,000 women still die because of pregnancy or delivery. Under 5 children, 5 million, we're losing them for preventable sources, and the right policies, evidence-based policies, through the support of decision makers and specifically parliamentarians can save this. Prevailing infectious diseases are still a problem, and the high economic and human burden of sepsis affects 50 million people every year. We have still inadequate response to non-communicable diseases like heart diseases, diabetes, cancer. Road traffic injuries, as already mentioned, they take almost 3 million preventable deaths, and it's a leading cause of a 5 to 29 age group population. Lack of sustainable funding of universal health coverage is still a problem. Overall, we are missing 370 billion funding for universal health coverage agenda. Inadequate pandemic response, growing environmental impact that we see every day. Every country is affected by the climate change. Underutilized capacities of digital health and inadequate investments and research and development. So again, this is not a complete list, but I think a visual summary of how many problems still remain in global health where the policymakers and parliamentarians can make a difference. Let me briefly review the universal health coverage and the pandemic accord meetings that happened in 2023 at the United Nations. As you all know, United Nations gathers every year for its General Assembly, where all the heads of states and the high-level delegations join. But for the global health agenda, UN is convening additional high-level meetings on the specific themes. This September, maybe some of you have been in New York and attended those meetings. UN holds the high-level meeting on universal health coverage and the pandemic accord. On terms of universal health coverage, the problem remains that still 4.5 billion people are not covered by essential health services globally. And back in 2019, when the UN adopted the Universal Health Coverage Political Declaration, it means that the goals and objectives have been missed, and there has been no accountability for this under performance. 2 billion people experienced financial hardships due to out-of-pocket spendings on health. And over 1 billion people globally incurred catastrophic out-of-pocket payments, and they were pushed in poverty because of the health or medical related expenses. So that is the biggest challenge that the universal health coverage agenda currently faces. And at the UN meeting, next slide, please, Anna. At the UN meeting, the heads of states and the member states of the United Nations adopted the political declaration on high-level meeting on universal health coverage, expanding our ambition for health and well-being in a post-COVID world. So, of course, the political declaration is available, and I would very much recommend you to look at it. It's a 20-page document, not very enjoyable to read, but you can find all the latest data on the main global health priorities and approaches there. It would be very useful if you are thinking and planning to become a stronger advocate for global health. Next slide. And the three, again, the document is pretty long, but if you would like to remember at least three key messages from the Universal Health Coverage Political Declaration from 2023 UN high-level meeting, it's that we have to focus on primary health care as the cornerstone of strengthening universal health coverage. We have to increase and ensure sustainability of financing for health with focus on domestic resources. So as the parliamentarians, you have the key for the budgets. You have the key for demanding more investments in health, first of all, for your own people, for your own constituencies, and then to request interparliamentarian unions or intergovernmental bodies to increase more in the official development assistance, innovative financing, or other international sources of funding. And finally, health information systems, digital transformation will be important for universal health coverage with evidence-based and gender equality approach for monitoring and evaluation. In terms of the second high-level meeting on the pandemic accord, I will not stop too long because the pandemic accord, the document that's an intergovernmental kind of international treaty, global treaty for the pandemic, is yet to be finalized. In New York, they discussed the draft of the pandemic prevention, preparedness, and response. And next slide, please. And this is the timeline, how the pandemic accords discussion starting back in 2022 in February. And the ultimate goal is that by May next year, the pandemic accord should be adopted. So what is important to remember is that if you have not been already part of the intergovernmental negotiation by the INB dialogue as the parliamentarian, try to get more information from your relevant ministries or participate at one of the dialogue. It's a lengthy, time-consuming, and technically pretty resource-committing process. But for you, it would be important to understand how the negotiations take place. And the most important goal is not to have another document, because we had the international health regulations back in even before 2000. I believe it was 1995. But because those documents do not have legally binding provisions from governments, that's why we've seen during the pandemic that some of the governments were following the international health regulations and some were voluntarily violating or avoiding or ignoring those regulations. So this time, the pandemic accord should have more legally binding provisions for the governments. Next slide. So the role of parliamentarians. In 3 slides, I will summarize. Again, if you are not a medical doctor or a public health expert, it doesn't matter. In fact, if you are not a medical doctor or not a global health expert, you might have a better strength compared to us, because you can explain and talk to your constituents with much simpler language explaining the problems of global health. We as medical doctors have this tendency of complicating with terminology and sometimes forget that our constituencies and public do not understand. So first of all, how you can influence global health agenda. You have to participate, try to participate in high-level global forums, both the UN General Assemblies and World Health Assemblies. So UN General Assemblies takes place in September every year, as you know, and the World Health Assemblies take place every year in May in Geneva. Also, please follow the high-level meetings, HLMs, on global health, including universal health coverage, TB, antimicrobial resistance that will be coming next year. And also try to participate at PAHO meetings, the Pan-American Health Organization meetings, that is one of the strongest sister organizations to WHO. Please advocate for increased and sustainable funding for health, both at global, regional, and country levels. And through this advocacy can benefit everyone, not only your country in Latin America, but every country, including Georgia as our home country. And support establishment of global health subcommittees or working groups in your parliament. This is a very important initiative that was first started by our colleague, the Member of Parliament in Germany, Andrew Ullman. He was the first who established globally the subcommittee on global health in Bundestag. And the subcommittee has been working brilliantly, bringing some of the key advocates and decision makers around the aspects. And the latest Virchow Prize laureate, like a Nobel Prize laureate in global health, she had the special hearing of the Global Health Subcommittee in the Parliament of Germany. Next, as the parliamentarians, you can influence, yes, the next please. You can influence your national health policies and transforming national level dialogue. You can initiate regular or ad hoc hearings of ministers of health at the parliament to discuss the strengths and weaknesses of your country's health systems. It's not necessary to only criticize the ministers, of course, but please just open the dialogue and understand where are the strengths and weaknesses of your country's health systems. You may organize joint discussions of health priorities between your health and finance ministries. And this combination usually works the best when the ministers of health and ministers of finance sit together and discuss the latest problems of the national health systems. Allocating additional financial resources usually is much better catalyzed. And you can also organize these meetings with the representatives of universities, academia, civil society, and international partners. And you can always rely on both UNITE, but the UN agencies, including UNICEF, WHO, or PAHO, representation for technical support to these meetings. And as the Member of Parliament, of course, you can prioritize a theme and initiate a new law or policy that can have an important impact on the health of your people. For example, tobacco control regulations, drug policies, or digital health regulations can make an important impact, and you can become the initiator of those important processes. Finally, the role of parliamentarians can be also as becoming an advocate of health. And the next slide, please. Advocate for health for all initiatives. As the parliamentarian trusted with the voice of your constituencies, please speak about the challenges and inequalities that your people are experiencing. For example, do they have freedom and free access to visiting doctor when they have a health problem? Do they have to pay catastrophic financial expenditures for accessing like surgeries or other high-cost treatments? So those are the issues that you can voice. Please use media interventions in TV, radio, and press to speak about your country's health systems. And also you can speak about the global health issues and the importance of contributing to this global development agenda. And you can work with community-based organizations, civil society, to hear better on what are the real health challenges in your societies and how best you can help to solve the problem. And the final slide in our presentation is about the practical discussions that I would like us to continue with. 3 questions. Please choose any question that you might be interested to. So first of all, which health area would you prioritize as a parliamentarian? The global health, national universal health agenda, specific priority diseases that are important for your country, health financing, digital health, or any other areas? Second, what steps would you take to advance your priority agenda? Research, multi-stakeholder consultations at national and global levels, drafting a legislation, parliamentary oversight, or others. And how can Unite Parliamentarians Network for Global Health can support you in your priority health agenda? So to move forward, of course, I'm ready for questions and answers, but these would be the questions that it would be lovely to concentrate and to focus on in the practical part of our session. Thank you.
Bueno, Mariam, muchísimas gracias por esta presentación y esta excelente introducción a, creo, las cuestiones centrales de salud global, por un lado, pero también qué temas de salud global nos importan como parlamentarios, como parlamentarias, o como miembros de equipos de parlamentarios y parlamentarias en Argentina, en Paraguay, en Cuba. Bueno, acá Mariam dejó 3 preguntas. Entonces, la idea es que elijan alguna, no sé quién quiere empezar, acá empieza el difícil momento donde alguien tiene que romper el hielo y tomar la palabra. Pero quizás alguien tenga ganas de contar o cómo les parece a partir de la presentación de Mariam, qué área de salud elegirían o priorizarían como parlamentarios o como equipo, digamos, qué les sugerirían ustedes a sus jefes o jefas si son staff. Bien, ahí Julio quiere participar. Y yo agrego algo que Mariam me tomo el
see the hand
atrevimiento.
from Julio Bogra.
Julio, sí. Y me tomo el atrevimiento solo de una cosita, Julio, antes de darte la palabra, de decir qué área priorizarían y por qué. Agrego la pregunta del por qué, ¿no? Que me interesa escuchar también y creo que a Mariam le va a resultar interesante también. Adelante, Julio.
Bueno, gracias, Ana. Buenos días, Mariam. Yo creo que hay que focalizarse más que nada en una agenda global, porque me parece que eso es lo que la sociedad en síntesis viene como reclamando, y más que nada teniendo en cuenta, uno a veces mira el tema de lo que pasó en la pandemia con el COVID y en todo lo que fue la vacunación, ¿no? Porque tratando de hablar de vacunaciones y de estas clases de enfermedades, me parece que es mejor hablar global, porque fíjense en que, por ejemplo, hay una gran diferencia en todo esto, ¿no? La sociedad no toda está al alcance de poder comprar su medicación, quizás, por los altos costos que tiene la medicación. Creo que habría que legislar un poco más en lo que es el tema de medicaciones con los laboratorios y con los costos, ¿no? Obviamente que sabemos que todos tenemos un trabajo, que el laboratorio es un trabajo, pero también me parece que hay que legislar un poco sobre esa cuestión para que todos tengan acceso a la medicación, ¿no? Por eso me focalizaba un poco más en lo global. Esa es una mirada que quizás en todo caso me gustaría que parlamentariamente cada uno de los parlamentos lo pueda tratar objetivamente y también llevarlo a las regiones, ¿no? Teniendo en cuenta los parlamentos que hay en las regiones. Me parece que en este caso también puede suceder tanto en América como en Europa, en la cuestión de tener una agenda prioritaria sobre lo que es la medicación. Esto quería decir, Mariam. Gracias.
Muchas
Wonderful
gracias, Julio.
suggestion,
Mariam,
Julio.
adelante.
Anna, how would you like to go? Shall we answer each question or group 3 questions?
I think it's better you can give Julio some feedback and then we go to the next question.
Yeah. Julio, thank you. Unfortunately, I don't have all the positions of the participants, so I would really appreciate it also if you could introduce like them for the next questions. Yes.
Ok.
Bueno, en mi caso, yo soy secretario de la Comisión de Peticiones, Poderes y Reglamento de la Cámara de Diputados de la Nación de la República Argentina.
Wonderful, wonderful, Julio. And your intervention was extremely important. Exactly. If all the parliaments prioritize engagement in global health, this can strengthen our joint voice. So you can not only strengthen Argentina, but the whole region and the other regions. And exactly, the global advocacy helps every country. You remember how COVAX facility was established. Without the international community effort, the vaccines would not be available to many low and middle income countries. So I can only applaud your focus. And please, if you are not part of the UNITE or IPU, please prioritize, especially to join the UNITE, and we can provide more information on how this happens. And specifically for your information, you know, there are international patents and intellectual property for especially new drugs. That's why, because companies invest a lot of resources, they are interested to regain the income. But there are two important regulations that you may know. This is Doha Declaration that provides waiver to the standard patents, and that's how the HIV medicines became available immediately without waiting for the patent's expiry in most of the countries. And the second is the Medicine Patent Pool initiative that wishes to make the voluntary kind of provision of or sharing of patents. So those are two initiatives. If you are interested in this specific drug pricing and international drug accessibility, I would advise you to look into these two sources as well. Thank you.
Gracias, Mariam, por la respuesta. Ahora viene Verónica, que había levantado la mano, luego Marcela. Adelante, Verónica. Y buen día, Vero.
Hola, buen día. Bueno, muchas gracias, Mariam, por tu exposición tan interesante. Yo también coincido con Julio que la salud global tiene que ser una prioridad, porque hoy ya el mundo tiene que pensarse más allá de las fronteras, no solo por la pandemia, también por la enorme circulación que existe de personas de diferentes países, con lo cual también hay que trabajar, por ejemplo, en acuerdos de reciprocidad respecto de la atención. La legislación tiene que tener una perspectiva también de interculturalidad. Y por ejemplo, la Organización Panamericana de la Salud promueve reuniones de los presidentes de las comisiones de salud de los parlamentos de la región, y eso es muy importante porque permite tener como una agenda sostenida, integrando las miradas en los diferentes temas, cómo se van trabajando en los distintos países. Entonces, por ejemplo, acá se hicieron sobre el tema de seguridad vial, que como vos decías en tu exposición se lleva muchísimas vidas y de una franja etaria de justamente de los jóvenes. Se hicieron también sobre el tema de salud digital, todos temas que necesitan como acuerdos, coordinaciones. El tema de resistencia antimicrobiana también son temas que para trabajarse en conjunto y en coordinación. Y yo me acuerdo que la representante de OPS en Argentina el año pasado, el anteaño pasado, le escuché en un momento que dijo que no tenemos que preguntarnos si vendrá otra pandemia, sino cuándo va a venir. Entonces, por eso la necesidad de articular esfuerzos de manera global para tener respuestas eficaces, y por eso coincidía con Julio en esto de que tenía que ser la salud global una prioridad, ¿no?
Gracias, Vero. Y como te conozco, me tomo el atrevimiento de insistir. ¿Qué pasos te parece? La pregunta B, ¿no? Que nadie se está animando a responderle a Mariam. ¿Qué pasos te parece que habría que tomar para avanzar en esto de, bueno, priorizar la agenda de salud global? Como miembro de staff de un senador, ¿qué te parece que habría que hacer?
Y a mí me
Esos
parece,
pasos que señala Mariam, ¿no?
lo primero, generar unos espacios de discusión para la construcción de una agenda que nos ponga, que permita construir esta agenda con los temas que les son comunes y que importan a los diferentes países, ¿no? O por lo menos a partir de la región, ¿no? Eso me parece que es central, porque cuando nos ponemos de acuerdo, empezamos a hablar el mismo idioma, empezamos a ver la trascendencia y las derivaciones que tienen determinados temas para todos, entonces es donde podemos empezar después a definir acuerdos de inversiones, legislación, normas, pero me parece que lo más importante es construir la agenda común.
Bien, muchas gracias, Mariam. ¿Quieres responder a
Yes.
Verónica?
Yes, I think that, it's just to reaffirm the importance of what Veronica said. Exactly. The common language is extremely important. Again, each voice from individual national assemblies and parliaments, if that can be added to the regional level and the region can become a leader in one specific global health priority. For example, let's make Latin America one of the exemplary regions in, adopting model kind of sample legislations in road safety, or as you mentioned, the digital health. And I completely agree. I met Dr. Barbosa, who is the PAHO leader, just last week in Berlin for the World Health Summit. Definitely, the pandemics are here. There are hidden pandemics and the visible pandemics, and we have to definitely strengthen the global health. And one important issue, let me highlight that even though we were all very mobilized during the COVID pandemic, what happened is that some fatigue started to global health. So people were so tired, so stressed with the pandemic and COVID. They didn't want to hear about infections. They didn't want to hear about sickness and illness. Okay, so now it's time. So as parliamentarians and policymakers, we have to ensure that the global community, UN and the decision makers, they don't forget about global health. No, we have to invest even more if we want to be stronger prepared for the next pandemics. So Veronica, thank you. Thank you very much.
Gracias, Mariam. Bueno, tiene la palabra ahora la diputada Marcela Campagnoli. Marcela, adelante. No sé si la tenemos a Marcela.
Ahí está, ¿me escuchan? ¿Me escuchan?
Ahí va, perfecto.
Primero agradecer la exposición, muy interesante, sumarme a lo que dijeron Julio y Verónica, sobre todo en la reciprocidad que no se da y que es importante con todas las migraciones que hoy hay en el mundo, pero además creo yo que hoy hay un flagelo en el mundo que son las adicciones de todo tipo, que se han incrementado con la pandemia, como la ludopatía, como el consumo de sustancias, como la depresión, con todos los trastornos mentales que se han potenciado con la pandemia. Y creo yo que en este esquema de salud global también deberíamos poder no solo compartir buenas prácticas o países donde han podido resolver con mejores participación del Estado estos flagelos, sino también, por ejemplo, en Finlandia, me enteré el otro día que una chica que tiene trastornos mentales, el Estado la capacita, es decir, la entrena para que pueda tener un trabajo. Es decir, hay cosas que se pueden hacer, que se pueden compartir, que se puede ayudar internacionalmente o desde una organización plural y multilateral como son ustedes, a influir en buenas prácticas. Yo hace rato, hace más de 3 años que vengo trabajando el tema de salud mental y el tema de adicciones. No está en la agenda política, no está, por más que es un flagelo en Argentina la cantidad de suicidios, sobre todo de jóvenes, y cómo se han multiplicado las adicciones, pero creo que son temas que hay que instalar en el mundo.
No, I'm so sorry, there was no... Anna, I couldn't hear the interpretation of the question. Could
okay.
you
I'll translate, I'll summarize. What MP Campagnoli explained was that in Argentina, after the pandemic especially, there was a high burden of mental health problems, suicide.
Bueno,
Ah, Sol, ¿estás ahí?
bueno,
Perdón. A ver, vamos a ver si está Sol. Ah, bueno, sigo traduciendo entonces yo. There was a high burden of different diseases that are also important to attend, and maybe there are some international examples. Sol, ¿querés traducir vos? O no sé por qué Mariam no escuchó. ¿Querés resumir lo que dijo Marcela o sigo con adelante con el resumen? Ah, esperen un segundito.
Absolutely. The mental health, unfortunately, I haven't because the pandemic and the universal health coverage was like the focus of our presentation. Of course, mental health is another major problem of global health. In fact, WHO says that the health is the complete lack of sickness and well-being physically, mentally, and socially. And Finland, you are absolutely right, Marcella, and other Nordic countries, Sweden and Norway also, they have some excellent evidence-based approaches to mental health. They have excellent infrastructure, community level, and deinstitutional approach to mental health. For example, I'm coming from a post-Soviet country where mental health was very tabooed and stigmatized, the patients, and they used to have only hospital-based care. But if we realize that every fourth person, so we are 24 of us, so 6 of us today on the call at some point in their life will have a mental health crisis, because that's how common the mental health issues are. And the crisis doesn't mean that it's a chronic problem, but burnout or stress or other mental health disabilities, they are very common. So it would be wonderful, Marcella, if you can take the mental health issue, and we would be delighted to link you up with members of parliaments in Finland or other countries who have better experiences.
Muchas gracias, Mariam, por la respuesta. Y sí, justamente iba a decirle eso a la diputada Campagnoli, que tenemos integrantes de Unite en Finlandia y en otros países de esa zona de Europa. Así que, bueno, más que encantada de recibir consultas de Unite. Ahora, ayer dejé mi correo, pero hoy lo vuelvo a dejar y también dejo la página web de Unite para que sepan cuál es nuestro trabajo y nada, es una red abierta, como les decía ayer, es una red abierta para recibir a nuevos parlamentarios y parlamentarias, Marcela. Así que encantada de mi parte.
Yes, of course, we will be very happy to see you as part of our network.
Yes. Lorena,
me va a encantar
ahí...
participar en la red. Cuenten conmigo.
Perfecto, Marcela, el lunes te llega un mail. Al mail oficial, o sea que hay que revisarlo.
Sí, sí, sí.
Lorena, perdón.
Excelente.
Buenos días, ¿cómo están? ¿Qué tal, Mariana? Un gusto escucharte. Gracias por toda la información que nos brindaste. Yo soy secretaria de la Comisión de Finanzas en la Cámara de Diputados de la Argentina. Me anoté unas cositas, comparto plenamente lo que dijeron mis compañeros, es más, complemento lo expuesto por Marcela. Me parece que las enfermedades mentales, y más aún después de la pandemia, se han puesto como en primer plano, me parece. Muchas cosas que quizás uno no las toma como importantes, me parece que son sumamente importantes. Claramente hay que tener un orden de prioridades. En realidad, en tu primer pregunta, todos los temas me parecen sumamente importantes, pero también me parece que van de la mano. Eh, sí, me parece sumamente importante el tema de la salud global, hablar de la salud global, pero incluso hasta pienso que dentro de esa salud global estaría el tema de las enfermedades especiales, de las enfermedades de salud mental. Em, yo lo que me parece que los pasos que se pueden seguir justamente en este curso que estamos de diplomacia parlamentaria, sería bueno tomar esa herramienta de la diplomacia parlamentaria para que los parlamentarios del mundo que pertenezcan a distintas organizaciones puedan tener este tema de salud global en sus agendas y llevarlos a sus parlamentos. Me parece que un paso a seguir sería ese como una buena herramienta. Y en esas agendas hablar claramente de salud global, incorporar el tema de enfermedades, porque muchas veces, y nos pasa aún en nuestros ámbitos laborales, muchas veces a nosotros en una comisión no nos suceden hechos que en otra comisión sí. Entonces, esto llevado a la salud y globalmente pasa exactamente lo mismo. Entonces, me parece que tenemos que juntarnos para conocer qué sucede en otros lugares, que nunca nadie está exento. Entonces, que no nos tome por sorpresa poder estar preparados quizás para cosas que ocurran. Y después, en lo que sería de Unite, me parece que también estarían buenos que ayude a estos encuentros de parlamentarios y provoquen estos encuentros para estos intercambios de ideas y de lo que sucede en cada lugar. Me parece que nos podemos enriquecer uno de los otros. Pero bueno, nada, era mi pensar. Gracias.
Muchas gracias, Lorena. Adelante, Mariam.
Excellent. Again, this was more a comment and intervention, and I can only fully agree about the importance of both mental health and other special rare diseases or issues that do not have enough attention. And Unite is ready to receive any request from you and to connect with other colleagues who have done work in this area. And just to give you an information, I'm sure Eleonor Silva, who will be coming next, she will tell you, but there is a new project of the Unite with the Harvard University, Virchow Foundation and Charité on the public policy lab. That's the purpose of this lab is exactly to identify success legislations, laws, and policies that have worked in different countries, translate, make it accessible to others as model legislation. So the new director, like a first director of the project, should be recruited by end of the year. So from 2024, we'll have the specialized lab also. Again, and at the brilliant initiative, Ricardo, the founder of Unite. And in the meantime, please let us know which area you would be interested in, and we can look for relevant policies. But again, as you mentioned, regional exchange of the meetings are very important. So thank you.
Gracias, Mariam. Claudia tiene la mano levantada. Adelante, Claudia Fritz. Si quieres contar para Mariam cuál es tu puesto o tu país, así, bueno, eso me olvidé decirle a los demás, pero vayan contándole así Mariam también sabe de dónde vienen, dónde trabajan. Y yo también, que no los conozco a todos.
Hola a todos, hola Mariam. Mi nombre es Claudia, trabajo en la Dirección de Relaciones Internacionales como asesora del Parlamento de la Ciudad de Buenos Aires. Y puntualmente tomo la pregunta número 1 y enlazo un poco con lo que planteó Julio. Básicamente con respecto, me parece que los parlamentos deberían profundizar mucho en enfermedades específicas. Doy un caso personal. En mi familia tenemos un primo de 35 años con esclerosis múltiple y a la hora de tener que abordar los tratamientos cuando son diagnosticados, donde el paso del tiempo acá es fundamental, el acercamiento, el poder llegar a la medicación, el trabajo con lo que planteaba Julio, los laboratorios, ahí parece que frente a enfermedades tan específicas habría que tratar de los parlamentarios trabajar más directamente en la facilidad de acceso a medicación. Entiendo y vuelvo a tomar lo que dice Julio de tal vez las trabas o no que puedan tener los laboratorios y sus vínculos con el Estado a la hora de facilitar la medicación, pero hay enfermedades específicas que realmente en donde el paso del tiempo es clave y donde los pacientes realmente tienen muchísimas dificultades y pasos burocráticos para acceder a las medicaciones que son sumamente altas, al punto de tener que vender un departamento como ejemplo, pero son sumamente altas y las personas entran en un estado de desesperación porque les resulta muy, muy difícil. Después, bueno, los pacientes se van convirtiendo en expertos en el tema y saben cómo abordarlo y a cuáles son las instituciones para poder llegar, pero son enfermedades que realmente a veces siento que están un poco, se toma las enfermedades comunes o más clásicas y hay otras que hoy la esclerosis tiene su tratamiento, es una enfermedad donde es muy escuchada, pero hay otras enfermedades mucho más extrañas, neurológicas, y el acceso, la accesibilidad a los tratamientos y a una medicación y una cobertura es altamente difícil. Entonces, me parece que ese es un punto interesante. Si yo fuese una asesora en materia de salud, avanzar en esto. En Argentina creo que la cosa está bastante encaminada, de hecho, nuestro familiar pudo avanzar mucho en esto, pero es un punto específico y muy difícil, de muy difícil tratamiento, me parece. Muchas gracias.
Thank you, Claudia. You have touched a very concrete and very specific health challenge that affects both individuals and countries and globally. Multiple sclerosis is, as you said, is not a common disease, but with increased diagnostics, we see more and more cases. And the problem with multiple sclerosis is not only that the new drugs are very expensive, but those drugs are not always effective. So even if you treat, you don't know whether you will have the best effect. But what the parliamentarians and Unite could do, and maybe this is something, Anna, that you can bring from the regional secretariat to the Unite HQ. When we said hepatitis C was also, drugs were extremely costly, $80,000 for treatment. So most of the people had to exactly sell their houses or to take bank loans. But what happened is that if countries join forces and consolidate their drug needs, it's called the pooled procurement, voluntary pooled procurement mechanisms for the drugs. So instead of Argentina, who might need this drug for a couple of hundreds of patients, if 10 or 20 countries unite and they agree that annually, for example, we need 1,000, 5,000, and 10,000 regimens, this could be a great motivation for the manufacturers to agree on substantially reduced prices. So that could be a joint effort of the issues. And I mean, I would love to see this initiative coming from Latin America and from your countries. And maybe we could also try and test how we can do it and which companies we can approach.
Gracias, Mariam, y seguro es algo que podemos empezar a trabajar desde Unite, esto que estás señalando como algo a pensar para el plan de trabajo de 2024 acá en la red regional. No estoy viendo, esperen que me fijo participantes. No hay nadie más con la mano levantada. ¿Alguien más que quiera hacer algún comentario? respondiendo a alguna de estas preguntas o alguna otra pregunta que surja quizás a partir de lo que presentó Mariam. Como les decía al comienzo cuando presenté su CV, es alguien con muchísima experiencia, con lo cual aprovechenla, que las tenemos unos minutitos más antes de hacer la pausa. Julio.
Sí, no, como para quizás, para finalizar esta etapa, me parece muy importante que hay que ponerse a pensar muchísimo, muchísimo en lo que decía Marcela. Marcela es diputada nacional en Argentina, viene trabajando en el tema salud mental, que es un tema importantísimo y voy a explicar por qué. Porque fijémonos que el tema de la pandemia, arrojó esta enfermedad que básicamente, si uno se pone a pensar, nos tuvo atrapados prácticamente 2 años en nuestras casas trabajando porque no dejamos de trabajar y empezamos a trabajar con home office. Al regreso, al regreso, hay mucha gente que se quedó trabajando en home office porque hay muchísimas empresas que les conviene el trabajo de esta manera. Entonces, fijémonos que hay personas que emocionalmente no están preparadas para seguir quedándose en casa trabajando home office y necesitan quizás salir y no pueden salir. Esto por un lado, sobre lo que decía Marcela, que es importantísimo. Y en la República Argentina, que estamos terminando un proceso electoral en la cual los diputados nacionales van a asumir en el mes de diciembre y se van a poner a trabajar en el mes de marzo, cuando empiece el nuevo periodo legislativo, es muy importante que tengan una mirada, por ejemplo, a lo que ya vienen haciendo legisladores como por ejemplo Marcela en la salud. Entonces, tiene que ser fundamental, por eso decía lo global, del tema de la medicación, porque es algo que la sociedad necesita y la sociedad a través de las leyes puede accionar. Entonces, si no tenemos leyes acordes para esta clase de problemática que le podamos acercar a la gente soluciones, va a ser complicado. Gracias.
Gracias, Julio. Tomo quizás, Mariam, las preguntas de Lorena y María y Marcela, la diputada Campagnoli, y respondés todo junto, ¿querés?
¿Puedo agregar algo?
Yes.
Sí, adelante Marcela y luego vamos a Lorena.
Bueno, primero agradecerle a Julio el reconocimiento, pero además no solamente es el tema problemático de la salud mental que se ha incrementado, sino es el tema de las familias que no tienen contención y no están preparadas para saber cómo reaccionar con un hijo adicto, con un hijo con un brote esquizofrénico. Entonces también es necesario capacitar no solamente a los efectores de salud, enfermeros, porque no es lo mismo una enfermera de un paciente horizontal que de un paciente vertical, como son los adictos o las personas que tienen trastornos mentales. En Argentina los monovalentes están prohibidos, entonces se tienen que atender en hospitales generales, que no está preparado el personal para ello. Las familias, nosotros tenemos reuniones los jueves a la tarde por una página que se llama La Madre Marcha de Madres de Adictos, para darles contención, es decir, indicarles qué es lo que tienen que hacer, qué es lo que pueden hacer, porque la verdad que hay un estado ausente con el tema de adicciones, sobre todo, y salud mental. Entonces, creo que también es importante la salud educativa, ¿no? Es decir, que podamos preparar a los que tienen un entorno, en su entorno, alguien con esta enfermedad o con estas adicciones o con la ludopatía, que es otra cosa que se ha incrementado muchísimo, poder darles herramientas para saber cómo manejarse y también contenerlos, ¿no? Solamente eso.
Gracias, diputada. Y sí, este año solo agrego esto. Estuvimos desde Unite trabajando un poquito, como les contaba ayer, el tema de salud mental en la región. Por ahora no lo hemos podido hacer a nivel público, digamos, sino en reuniones internas entre los integrantes de la red, en un ciclo de charlas que les contaba ayer, que se llama Diálogos de la Pospandemia, y tuvimos el primer diálogo, justamente lo dedicamos a salud mental y comentamos el caso de Ecuador, el caso de México y el caso de Argentina. Vero estuvo ahí presente como parte del despacho de Mario Fiada. Así que bueno, ojalá podamos seguir trabajando cada vez más ese tema, que como hablamos siempre con la presidenta de la región, Gisela Scaglia, es como la pandemia después de la pandemia, ¿no? Los problemas de salud mental en la región, porque no es solo Argentina, acá ya se puede dar una mirada regional, como la pandemia que vino después de la pandemia de COVID es el tema de los problemas de salud mental y como bien señala el problema de las adicciones. Lorena, perdón que te había dejado detrás. ¿Es sobre
No,
este tema o
tranqui.
preferís que
Sí,
Mariam responda?
sí, en realidad es sobre este tema y sobre la pregunta que dejó Sol de cómo puede Unite apoyar la agenda. Lo de Marcela me hizo acordar cuando escuchamos a la mamá de Chano, un cantante acá de Argentina, la
¿Querés contar un poco
desesperación.
cómo es? Porque Mariam seguro no está al tanto.
Claro, bueno, este cantante tiene problemas de adicciones importantes, ha estado internado, a la madre le ha costado mucho después internarlo por cuestiones legales, porque a veces el paciente no se quiere internar, y a mí me tocó mucho la historia de ella, porque estamos hablando incluso de una persona que tiene llegada a los medios. Entonces, aún así, con una persona que tiene llegada, que es conocida y todo, la desesperación de esa madre era terrible. Entonces, cuánto importante es esto que decía Marcela, eso de poderle dar herramientas a las familias, incluso herramientas legales, eso hay que rever también. La parte legal, porque a veces la parte legal a un familiar que quiere ayudar lo ata de manos. Entonces es muy desesperante, me parece. Y en base a la pregunta que dejaba Sol, ¿cómo puede Unite apoyar la agenda? Me parece que hasta incluso estos encuentros, estas participaciones de Unite en este tipo de encuentros, me parece muy favorable para hacer conocida la organización y para poder llegar a distintos parlamentos. Me parece que, como vos nos contaste ayer, quizás a partir de los presidentes de las regiones que ustedes tienen, que hagan llegar a los parlamentos propios de cada región la actividad de ustedes, como para que también ahí puedan armar una agenda de prioridades en cuanto a lo que ven de la región, de las regiones, de la necesidad de las regiones, y facilitar la llegada a estas distintas organizaciones, como decía Mariam, lo que es con los laboratorios, dependiendo el tema de agenda. Pero me parece sumamente importante la participación de ustedes en este tipo de encuentros, incluso como para llegar, acercar a los parlamentarios. Simplemente eso. Gracias.
Gracias, Lorena. Fabiola, es sobre este
Anna,
tema. Yes,
yeah.
go ahead, Mariam.
Yeah, just because there has been a long discussion, so very briefly to say that I think that from today's class, we already have an excellent output. Like we have identified one big priority of mental health, not only in post-COVID, but in the overall, where we can focus. And we can also organize specialized classes on mental health. We could bring experts who can provide advice on specific regulations, what can be done. And very briefly, this is again, if you look at the global health issues or public health issues, you can really very easily divide all the interventions on mega, meso, and micro level. So when we speak about the policies, it will be the mega intervention. Institutional reforms would be meso, institutional, and the idea of educating parents, families, communities, that's like a micro-level interventions where we have to definitely partner with civil society and technical experts. So I'm delighted to hear this intervention. And Marcela, Julia, Lorena, thank you for reinforcing. And we will definitely speak with Unite and organize a special session on mental health policies.
Gracias, Mariam. Bueno, como ven, Mariam me va a hacer trabajar organizando eventos sobre esto el año que viene.
Yes.
Fabiola, sí, adelante. Si quieres
Hola, ¿qué
comentar
tal?
brevemente desde cuál es tu
Sí,
puesto de trabajo y demás.
sí. Buen día, buenas tardes, Mariam. Muchísimas gracias por tu participación. Felicitaciones por tu currículum. Mi nombre es Fabiola Frías. Bueno, soy abogada, trabajo en el Senado de la Nación, soy asesora de una senadora que también es médica, es infectóloga y le interesa muchísimo el tema de salud. Desafortunadamente nosotros no conocíamos la existencia de Unite y ayer Ana inmediatamente ya me pasó su mail, todo, así que creo que es una gran oportunidad la que vamos a tener de poder intercambiar información, ver si podemos trabajar juntos, que seguramente que sí. Y quería contar en realidad básicamente, o sea, me adhiero mucho a todo lo que dijeron mis compañeros antes. Tomo un poco prestado lo que dijo Marcela con respecto a la salud mental. Me parece que es uno de los temas más graves que tenemos. Yo por circunstancias personales suelo viajar seguido o cada tanto a Nueva York, y he visto la involución de Nueva York, o al menos a mi criterio, en estos últimos 10 años. No es la misma ciudad. Bueno, ahora ya está permitido el consumo de marihuana libremente. He visto gente inyectándose en la calle. Hay carteles por todos lados que dicen que no debemos mirar a la gente a los ojos. En el subte te piden que si ves una persona que está como desvariando, que no la hables, que no la mires, que no intercambies con ellos. Se ponen absolutamente agresivos. Y para mí, creo que afortunadamente todavía no vivimos esa situación en Argentina, pero un poco la pregunta esta que decíamos, ¿vendrá otra pandemia? No, creo que la pregunta es ¿cuándo va a suceder acá esto? En algún momento vamos a estar vivenciando las mismas situaciones, los mismos quizás estigmas que están pasando otros países en este momento. Y esto comparto de nuevo con lo que dijeron mis compañeros, de apuntar a la agenda global, es si vemos algunas realidades de que están ya sucediendo con respecto al impacto que ha tenido la pandemia y otras circunstancias más, las circunstancias económicas, sociales, son las que nos van a ir dando la pauta cuál es el camino que tenemos que seguir para trabajar en materia parlamentaria. Yo creo que los parlamentarios, creo que difícilmente alguien se vaya a oponer a temas de salud. Me parece que la salud, la educación siempre son temas centrales, son temas ejes en cualquier política. Sí creo que a veces son las formas únicamente las que difieren por cuestiones ideológicas, pero el fondo creo que todos vamos a estar siempre de acuerdo en que debemos generar políticas públicas a largo plazo, debemos mantener una línea y permitirnos ayudar por la comunidad internacional para descubrir cuáles son los problemas que nos vienen por delante. Muchas gracias.
Muchas gracias, Fabiola, por el comentario. Mariam, no sé si Vero va en la misma línea y tomamos tu comentario.
Voy a
Y
la
después
misma.
Mariam responde a las
Yes,
dos y
absolutely.
cerramos
Let's wait
esta
for her.
primera parte de la clase
Yes.
y hacemos la pausa. Adelante, Vero.
Bueno, no, lo que yo quería decir es que una cosa buena que sí tenemos en materia de salud mental es que se ha cambiado el paradigma del abordaje de los problemas de salud mental, porque antes la persona que tenía un padecimiento de salud mental era vista, o sea, sufría un estigma, y era como la persona peligrosa de la cual yo me tenía que proteger levantando un muro. Hoy tenemos otra mirada de la salud mental, y que es que tengo que tender un puente y que tengo que ayudar a esta persona. Entonces ya no es una mirada como punitiva de la salud mental, sino cómo me protejo, sino cómo lo integro, cómo lo ayudo, cómo construyo. Y en ese sentido, lo que decía Marcela, que me parece muy claro, y es otra cosa que tenemos que tener, que tenemos que pensar, es que esto es más allá de los efectores de salud, porque si bien es salud mental, pero el tema trasciende eso porque demanda acciones que son intersectoriales, interdisciplinarias, como decía, cómo capacito a la familia para que pueda ayudar, cómo capacito a los docentes para identificar un tema, cómo capacito al personal de las fuerzas de seguridad, que probablemente son los primeros en llegar al escenario en donde la persona está en la terraza del 8º piso y se quiere tirar, y a lo mejor el primero que llega son las fuerzas de seguridad, y entonces hay que capacitarlo para que mínimamente pueda entablar un diálogo y sostenerlo hasta que llegue la persona capacitada para poder intentar desalentar esa conducta suicida. Entonces es una tarea que es intersectorial y que es interdisciplinaria. Y lo que yo rescato es que por lo menos ya no lo miramos como una persona peligrosa, sino como una persona de la cual toda la sociedad tiene que asumir la responsabilidad de ocuparse para atender, para ayudar, ¿no?
Gracias, Vero. Mariam, bueno, si querés
Absolutely.
tomar estos comentarios y
Yeah.
ya cerrar esta parte de la
I
clase y te
think that it
dejamos
was an
empezar
excellent
tu noche.
conclusion. Yes, it was excellent conclusion that yes, most of our countries, fortunately, are seeing this change of mentality and attitude towards the mental health patients, because how they suffer is much more challenging. That was what we see as an outsiders, especially if we're not members of their families. So I have I have a lot of experience personally, so I mean I don't want to burden you with this with my experience, but absolutely this is extremely important and intersectoral, partnering with education, partnering with law enforcement ministries would be extremely important. And again, I see that, you know, maybe after Nordic countries, Scandinavia, Latin American region will become the next leader in mental health, because I see that the interest is amazing, and we have to use this interest and build on this interest and really do something great, not only for your countries, but from which other regions and other national parliaments can benefit. As you said, it's I think it was Fabiola said that it's a long term. So the policies we make as parliamentarians, the laws we make, that's a long term effect kind of intervention. So if we do it, and if we spend at least 1 year, if not more, let's do it properly. Let's do it to the best possible evidence and knowledge. So I really see, I'm sure that Ricardo, like in India, we will be meeting soon with the global board, and I'm sure that Ricardo and other members would be very happy to see this interest towards mental health from your region. And Fabiola, absolutely, please join us. Currently, we're over 400 in 104 countries, but we started really, I'm very proud that I've been one of the very first to join Ricardo Baptista Leiter as that time I was the member of parliament, chairperson of the parliamentary committee. And, you know, seeing Unite so stronger, and both WHO, the World Health Organization, and IPU already identify Unite as the leading interparliamentary group with expertise in global health, because IPU doesn't have expertise. And I mean, we are the only network of current and former parliamentarians that are focusing on global health, and more we will become, more members we will have, stronger our voice, and our foundation will build for impacting lives and saving millions.
Bueno, muchas gracias, Mariam, por esta excelente clase, por la conversación y el tiempo para estar con nosotros acá en Latinoamérica. Y bueno, si les parece, la despedimos a Mariam.
Yes, the pleasure was all mine. It was a wonderful class. I look forward to our future possibilities of being in touch, and all the best. Thank you.
Les cuento que Mariam ya estuvo con nosotros este año por mayo, junio, que hicimos un curso breve, todo sobre salud global, también dentro de la Austral. Así que bueno, es la segunda vez que tenemos el placer de escucharla acá en la universidad. Bueno, si les parece, hacemos una pausa de 10 minutos hasta y 45 y nos volvemos a encontrar para la presentación de Eleonor Silva, que también les va a poder contar mucho más que yo lo que está haciendo Unite a nivel global. Muchas gracias.
Thank you, Mariam.
And unfortunately, I would not be able to join you for the second part,
No,
but
me
I'm
imagino va a ser tardísimo para vos, me puedo imaginar. Gracias por estar. Nino. Nino es mi colega, ella es coordinadora regional de Unite para Europa del Este. Sí, adelante, Nino.
Yes, dear ladies and gentlemen, esteemed colleagues, it's a great pleasure to see so many of you gathered here today, eager to extend your horizons and contribute to the betterment of global health. So first of all, I would like to extend my gratitude to our incredible speaker, Mariam Jashi, for her comprehensive presentation and the invaluable insight she has shared with us Her expertise and dedication to this field of global health have undoubtedly enriched our understanding of this critical topic. So together we can strive to address the pressing issues in global health and work towards a brighter and a healthier future for all. Thank you, Mariam, once again. Thank you, Anna, and your colleagues. Thank you for this great opportunity.
Gracias, Nina. Muchas
All the
gracias.
best,
Thank you, Nina.
all the best. Thank you.
Bueno, entonces, si les parece, hacemos una pausa, despedimos a Mariam y nos volvemos a encontrar en 10 minutos para la segunda parte de la clase. Las cámaras. Bueno, si les parece, empezamos. Recuerden que Eleanor también va a hablar en inglés, así que sigan en el mismo canal de interpretación donde estaban, o si se fueron, vuelvan para poder escucharla a Eleanor en español, si lo desean, y si no, si desean escucharla en inglés, quédense en el canal de audio original. Bueno, empezamos entonces con nuestra segunda parte de la clase. Es para mí un placer enorme presentar ahora a quien coordina las actividades de la Secretaría de INAI donde yo trabajo, así que nada. Sí, conocí a Mariam, más conozco a Eleanor porque trabajo con ella todas las semanas. Eleanor es la directora ejecutiva de Unite y previamente se desempeñó como responsable del área donde yo estoy trabajando ahora, del área de compromiso parlamentario, donde reclutamos a todos los parlamentarios, trabajamos con ellos y con ellas. Estudió Derecho y luego Comunicación, completando dos másters en la Université Paris-Dauphine y el CELSA Paris-Sorbonne. Después de una experiencia diplomática en Brasil, porque Eleanor es mitad portuguesa, mitad francesa, así que después de una experiencia diplomática en Brasil, se incorporó a una organización que tiene en algún sentido algún funcionamiento similar a Unite y que seguro muchos de ustedes conocen, que es el Global TB Caucus, que es una red de parlamentarios que trabaja el tema de tuberculosis. Y allí en el Global TB Caucus se encargó de las comunicaciones y la promoción de políticas en los países de habla portuguesa. Y desde allí coordinó el lanzamiento del caucus lusófono sobre tuberculosis. Eleanor ha encontrado una verdadera vocación en la defensa de la salud mundial, donde ahí ella ejerce su pasión por la política y las relaciones exteriores, al tiempo que crea un impacto positivo trabajando por el bienestar mundial. Así que bueno, si les interesó por lo que veo la red Unite, por las preguntas que le hicieron a Mariam, también pueden ahora aprovechar a Eleanor, que tiene, bueno, nada, está hace mucho más tiempo que yo en Unite y tiene una gran experiencia a nivel global. Entonces yo conozco las cosas de Unite globales, pero poquitito, porque trabajo mucho en la región, pero pueden aprovechar para preguntarle a Eleanor y escuchar de ella su experiencia en el trabajo que lleva adelante Unite en todas las regiones. Eleanor, adelante, bienvenida.
Gracias, Ana, y buenas tardes. No, hola a todos.
Creo que
Podría hablar en
todavía
español
buen día español.
porque vengo de Portugal, pero mi español es muy portuñol, como lo decía. Entonces es mejor hacer la presentación en inglés. Thank you, Anna, for the introduction. And thank you all for being here. It's really an honor and a pleasure to be here with this class of Universidad Austral. It's a partnership that we started, I think, last year already, and it's something really, really deep to our heart at Unite. So I'm very happy to be here. I followed also the presentation of Mariam. So Mariam, as you understood, is the chapter chair of Unite for the Eastern Europe region. So she leads the strategy and the thinking of the organization, and we at the Secretariat, so Anna and myself, we do the day-to-day work of implementation of what the chairs, people like Mariam, have in mind and how they want to guide the organization. She spoke a lot about what is global health, why it matters, what are the challenges, and you had a discussion more focused on the areas of work, such as mental health, for instance, and others that you have pointed out. I will do a complementary presentation, which will be more around what are the mechanisms for you to get involved at global level. So now that we have identified what are the topics, and Mariam also already touched upon the pandemic accord, the UN high-level meetings, etc., I will get a little bit more deeper into what UNITE does to help parliamentarians to get into these fora, what you can do there, how you can join your delegations, and how it can help your work at the national level. So I will share my screen. And I will show you the presentation here. Just let me know if you can see it right. Yeah, okay. So I have divided the points into, well, I was about to give you an introduction of UNITE, but I've seen that it was a big topic in the past class, and also I know of yesterday, so I won't get too much into it, but just focus on what matters for the rest of the presentation. Then some points on the role of members of parliament in global fora, and then I will just get into each one of them to understand what is your experience there and what you would like to work on there. So the World Health Assembly, the UN high-level meetings, the process of the pandemic accord and how UNITE is working on this, the World Health Summit, which is also an important platform. I'm not sure it was mentioned before because it's more private sector, but we need to work with all stakeholders, so it's important also to be very represented at the World Health Summit. And I know Mariam also mentioned already the Global Health Subcommittees, but I have some questions for you on this as well. The way I wanted to have this class was just to go through each point, and then I thought about some questions to ask you, but also to answer your question if you have some. So at every time that I pass a chapter, then we can have a moment of Q&A and not let it to the end of the session. So about UNITE, you've heard this several times, but we are a network of former and current members of parliament. We are now present in 106 countries and we have 500 members. We were founded by Ricardo Batista Leite. He's a member of Portugal, a member of parliament in Portugal, but he is now the CEO of an international organization called IDER. So he's working on artificial intelligence for health. And this is also a topic that we are now focusing way more at UNITE, and I think of interest for each one of you here in the room, because it's still something that we don't have a proper understanding, but we already need to legislate on it, but that's for another moment. The main goal of UNITE is to support parliamentarians into turning science and data into evidence-based policies. We do it by connecting, because we are a network, right? So our main tool is to connect parliamentarians with international organizations, affected communities, academia, government, civil society. And here on this presentation, we will focus on the international organizations and how UNITE can be a bridge for your work with international organizations and UN agencies. We have a strategic plan until 2025. It follows the Sustainable Development Goals, missions, and it is revolving around three main pillars: health as a human right, health system strengthening, and global health architecture. And this is the third pillar. That was one of our priorities in the past years and still is, with the pandemic accord, with the high-level meetings, etc. This is the one that we will be talking a little bit more today together. Some examples of how UNITE is present at the global stage. So here talking about global work, not regional or national. UNITE is a relevant stakeholder in the negotiations of the pandemic accord. That means that we were chosen by a member state to represent civil society in the negotiations of the accord. We have access to all the meetings of the international negotiating body. Some of them are closed, some of them are open, but we have access. And we are able to give inputs to the work of the international intergovernmental negotiating body, which is a group of co-chairs nominated by member states who are negotiating the pandemic accord that will be adopted and then ratified in your parliaments in a few months. So we are a part of this process. We also work on increasing the participation of parliamentarians and staff of parliamentarians as well in the global health fora, such as the World Health Summit, the World Health Assembly, the spring meetings of the World Bank and the IMF, and the UN high-level meetings. And that's going to be the big focus of what we're going to talk about today. We, for this year, for instance, we had this process that Mariam already mentioned to you of the high-level meetings on tuberculosis, universal health coverage, and pandemic prevention, preparedness, and response. And for those meetings, we had representation of several members of parliament who made more than 10 statements on those forums. So they were represented there, thanks to the help of UNITE. Here, just a few considerations on why do we think at UNITE that parliamentarians are an essential piece of the new global health architecture. So there are main reasons, but you know them more than us actually. But we think that there is a real movement of shuttle, I would say. This is my next slide, between the members of parliament to represent their constituents and the civil society, going to the UN debates and coming back to the national parliaments. So what we have seen in the past years is that for the debates at the UN level and global fora to be more anchored into reality and data and experience, the role of parliamentarians is crucial to bring the vision of the people, the vision of the constituents to these debates that sometimes can be very theoretical. And so we need the parliamentarians to bring this very concrete and day-to-day approach and the voice of people. And then the fact that we have the parliamentarians in the global debates, it opens their awareness on the topics that are being discussed and the commitments that are being made by their governments. So that then when they come back to the national level, they can truly hold their governments accountable because they know what's been discussed at global level, which is not always so automatical. And that leads me to my first moment of questions with you, which is I wanted to ask you and wanted to understand how the governments in your country do communicate these commitments at global level. Are you aware of the debates that are being held, for instance, this UHC, Pandemic Prevention, Preparedness and Response, and TB high-level meetings? And did you already have experience in questioning governments on their commitments at the global level? So that was the two questions that I wanted us to tackle together. And of course, if you have at the moment already questions about UNITE or what I just said, please don't hesitate to.
Entonces, lo mismo que decía con Mariam, algún candidato o candidata para romper el hielo y contar un poco a Eleonor y empezar a conversar sobre esta primera pregunta. Cómo comunica aquí en la región, cómo comunican los gobiernos, los compromisos, los acuerdos hechos en el nivel internacional. Cómo llega eso a los parlamentos. Y si ustedes tienen trabajando en los despachos o quienes son parlamentarios como parlamentarios la experiencia de
hacer preguntas al gobierno, al ejecutivo, sobre esos compromisos que se asumen a nivel internacional. Julio, adelante.
Hola, buen día, Leonor. Yo creo que básicamente toda esta respuesta a lo que vos estabas diciendo parlamentariamente, quizá uno lo puede ver reflejado en los trabajos que se hacen a través de la Cámara de Diputados y la Cámara de Senadores, ¿no? Cómo trabajan los parlamentarios en este sentido, a lo que vos decías. Lógicamente que quizás para el ciudadano común es muy difícil enterarse de todo este trabajo que se viene haciendo, tanto en estas reuniones o en estos foros que vos comentabas, y que después los parlamentarios bajan a los parlamentos, ¿no? Entonces, la información para el ciudadano común creo que no es completa. Nosotros porque quizás estamos en el ámbito parlamentario y la diputada Campagnol, y que ella ya viene trabajando hace más de 3 años en la salud mental. Es muy importante que la ciudadanía también se entere, ¿no? de estas cuestiones que los parlamentarios trabajan, porque no nos olvidemos que los parlamentarios están donde están porque los ha votado el ciudadano. Entonces, la información tiene que ser clara y precisa a las necesidades de la sociedad. Gracias, Eleonora.
Lorena, Eleanor, would you like that I take this question and this comment and then you reply?
Sure.
Bueno, hola Leonor. Mira, más que nada, esto también yo les contaba, desde que estamos haciendo la diplomatura, siempre sale el tema de la comunicación, justamente, que ahí es como que a veces, incluso en la diplomacia parlamentaria, es donde se encuentran a veces las fallas, de que a veces no llega la información. Entonces, me parece que siempre es un tema recurrente en las distintas áreas que surge de cómo llegan a los distintos parlamentos lo que se hace en estos foros internacionales, que muchas veces en los países es más fácil comunicar todo lo malo o desde la prensa o desde los parlamentos. Nosotros en la Argentina recién ahora, hace unos años, tenemos en nuestra página de diputados, no de Senado, el área de diplomacia parlamentaria donde se comparte un poco más lo que se hace en nuestros grupos parlamentarios de amistad y en nuestros equipos internacionales, pero falta, porque justamente también hablábamos de nuestra página. Tendría la opción para el inglés, la cual no está activa. Entonces, me parece que ahí es donde también hay que trabajar mucho en la parte de la comunicación, porque es ahí, me parece, donde a veces quizás se hace un montón de cosas que a veces no llegan a destino como para después bajar a la sociedad.
Gracias, Lorena. Martín, si querés, y contanos un poco, bueno, cuál es tu puesto de trabajo, dónde estás, también para que Eleonor sepa.
Dale. Trabajo ahora actualmente en la Cámara de Diputados, anteriormente en la Cámara de Senadores, siempre referido en lo que es aprobación de acuerdos internacionales. Y en ese marco hubo un acuerdo que no sé si United estuvo trabajando en que se apruebe o no, que es el convenio marco para el control del tabaco, impulsado por la Organización Mundial de la Salud, que si bien fue firmado por el gobierno argentino, nunca fue ratificado por el Congreso, y creo que es un caso bastante paradigmático de cómo las provincias tienen un poder en la política exterior argentina, a pesar de lo que marca la Constitución, y está bueno para poder analizar cómo las provincias se han negado a que esto se apruebe. Sí, Dina dice que lo están trabajando en la Comisión de Salud, pero el acuerdo tiene un historial desde el año 2005, así que la realidad es que soy bastante escéptico a que se pueda aprobar. Me sorprendería un montón, de hecho, porque ha habido, a pesar de que lo ha impulsado el Ejecutivo, ha habido también congruencias con partidos opositores y aún así no se ha podido aprobar a lo largo de, vamos a cumplir 20 años. Así que cuando leí la segunda pregunta fue el primero que se me vino a la cabeza.
Eleanor, ¿querés, bueno, comentar un poco sobre los comentarios que aparecieron?
Sure, thank you, and thank you so much for answering the questions. So I think that the communication, as you said, is really key, and that's really one of the aim of our work around this involvement in global fora, because we do believe that it's important that citizens are aware of what's being discussed, so that they have then the tools to question the government when things are not being aligned, because there is too many examples in health of political declaration, whether it is on TB, universal health coverage, HIV, and all other topics, that they just remain on paper and then they are never applied. And we do believe that this is also because these debates are being held very far from the rest of the world, in a way of speaking. And a very interesting comment on the tobacco framework. We haven't worked on that at Unite because Unite didn't exist when the tobacco framework was adopted, but it is something that is being really discussed right now because of the pandemic accord. And a lot of people who are involved in the negotiations of the pandemic accord use the tobacco framework as a success. It is always seen as a success in negotiation. And it depends on the countries, right? And we will have, I mean, in the next slide, I'm going to talk a little bit about the pandemic accord and the ratification process. And this is going to be more or less the same problematic, because maybe Mariam, I think, already mentioned to you, but the pandemic accord is supposed to be adopted in 2024 at the World Health Assembly in May. And depending on the constitution of countries, and depending on political regimes, then it has to be ratified or not. And we know that this ratification process is going to be really difficult. But if the treaty is not ratified, then it's not applied, and it's a cooperation treaty, so it needs to be applied by a maximum of countries. So it's going to be the same problematics coming back for this one. I see there's another question.
Sí, Santiago. Gracias, Eleanor.
Gracias. Más que una pregunta, igual es un comentario. Las comisiones, la verdad, en Argentina...
¿Querés contarnos, Santiago? Disculpa.
Sí, perdón.
¿Dónde
Mi nombre es Santiago
trabajás?
Rodríguez. Yo soy secretario parlamentario de Evolución Radical, uno de los bloques dentro del Congreso, dentro de diputados. Lo que te iba a contar, en realidad, Eleanor, las comisiones en Argentina no han tenido mucho éxito en lograr que tanto la Comisión de Relaciones Exteriores, puntualmente por tratados internacionales, como las otras comisiones, quizás relacionadas a temas de salud, que los ministros del área vengan a la comisión a hablar o a ser interpelados. La verdad que el feedback en ese caso ha sido bajo. Durante la pandemia, sí, miembros del Ministerio de Salud quizás fueron más, estuvieron más presentes en algún grado, pero más o menos. Ya veo alguna cara que se levanta entre las que me miran y sí, por eso, más o menos. Después, en realidad, hay una instancia donde los diputados o los senadores pueden cuestionar o preguntar al gobierno, que tampoco se cumple del todo, pero más o menos se ha cumplido, y es que el jefe de gabinete de ministros, una vez por mes, debería hacer como un análisis del andar del gobierno, digamos. Y tiene una instancia en la cual los senadores o diputados pueden enviarle preguntas que va a contestar en el momento en que asiste. Dentro de esas preguntas, muchas preguntas están relacionadas con acuerdos internacionales o puntualmente con cosas de salud. Entonces, en esa oportunidad sí se da que quizás, no durante la interpelación, pero sí en el informe que viene adjunto, el gobierno puede tener algún intercambio específico respecto a estas áreas. Ya está.
Adelante, Eleanor. Gracias, Santiago.
Thank you for your comment and for explaining the process. In Portugal, it's very similar, and but we know that every country has its own way of functioning, and that's why at Unite, at least we try to have the more adapted response and support to every parliamentarian we work with. But this is not very easy all the time. So if you don't mind, I can now go through all the big instances we work with and the big events, and then we can have some time to share impressions again. But thank you so much for your comments, who were really enlightening. So here, okay, great. I've lost my screen, but 1 second. Okay, so I'll start by the World Health Assembly. I think Mariam also said a few words on the World Health Assembly, but I'll be quick. So as you know, the World Health Assembly is the decision-making body of the WHO. It is attended by delegations from the member states and focuses on a specific health agenda that is prepared by the executive board of the WHO, which is a board that meets twice a year on other occasions and also during the World Health Assembly. The main functions of the World Health Assembly are to determine the policies of the organization, to appoint the Director General, and also to approve budgets. The Health Assembly is held annually in Geneva, in Switzerland, at the end of May, every year. It never changes. Next slide. Okay, just a few words on the last World Health Assembly, which was held from the 21st to the 30th of May 2023. It was the 76th World Health Assembly, but it was celebrating the 75th anniversary of the WHO. And the topic this year was saving lives, driving health for all. It is important because this year was, as Mariam also mentioned, a year where the global debates on health were very focused on universal health coverage and especially primary health care. As the central topics of the World Health Assembly of 2023, we can see 4 of them. The first one, without surprise, is the preparation for pandemics and the global health architecture, which is on everyone's mind at the moment. The World Health Organization is really focusing the work on this topic right now because they really want the pandemic accord to be adopted in May 2024 for a lot of reasons, because it is really time to act now. But, you know, there are also political considerations around it because there are many big elections happening after May 2024, and it is not so sure that new governments in place will be so easy to be convinced, I would say, in this way. So May 2024 is a very big milestone. What was seen at the World Health Assembly was the progress report of the intergovernmental negotiating body doing the pandemic accord, but also the progress report of the amendments of the international health regulations, which is also a process which is occurring in parallel to the pandemic accord. There was also big discussions on monitoring and tackling of ongoing emergencies. You know that there are several infectious diseases outbreaks, especially in the Asia-Pacific continent, in Africa, but also in Latin America. and also some updates on what we call the Global Health Peace Initiative, which is a program to withhold and to secure health during conflicts. And, you know, we've been witnessing a lot of conflicts lately with the war on Ukraine, and also now the situation in the Middle East. And so it is now more than ever important to ensure that citizens have access to health, even in conflict zones and conflict times. Then the second part, the second big focus of the World Health Assembly was universal health coverage in primary health care especially. There was a resolution adopted at the World Health Assembly, which is supposed to be combined to the political declaration on universal health coverage adopted in September. And it is important to note here that the WHO estimates that up to 90% of essential health services can be delivered through primary health care, and that investing in primary health care could increase global life expectancy by 6.7 years by 2030. And that's really the big segment here. Another topic which is very dear to the WHO for many reasons, and also for us, is sustainable financing. Sustainable financing for global health, but sustainable financing also for some organizations, including the WHO. The WHO is financed today by assessed contributions by member states, but then the rest of the contributions are programmatic based. So it is very difficult for the World Health Organization to have a sustained agenda and budget because they function by programs. So the WHO is advocating, and a lot of countries are following this step, advocating for more assessed contributions, which are the contributions of the states that are mandatory, I would say. Oh, wait, sorry. So that they have more what we call core funding and less programmatic funding. This is a problem that we can see in every organization depending on the level of the level of the organization. So, and other topics which have been discussed are the new global health challenges, such as planetary health, the health impact of environmental and social factors, and then also a draft global framework on these matters. What we do at Unite for the World Health Assembly, usually we organize a field trip visit to Geneva at the margins of the World Health Assembly. We have done that 2 years in a row, and we will do it again in 2024. And I welcome you to this field trip, of course. Within the 2 previous years, we had members of parliament from Angola, Georgia, Lithuania, Philippines, Portugal, Tanzania, and the UK. People, I mean, members of parliament who joined the field trips were able to attend the World Health Assembly within their delegations, and also the side events to the World Health Assembly. And then we had several bilateral meetings with international organizations such as the Global Fund, UNITAID, Gavi, Harm Reduction International, the International AIDS Society, and then we also adapt the agenda in function of what are the topics of the World Health Assembly, but also what are the areas of interest for the parliamentarians we work with. This year we tried something new and something that we will continue working on, and in collaboration with you, is a campaign that we call Join Your Delegation. So we have understood that parliamentarians, depending on the countries, of course, they don't have such an easy access to the national delegations, to these big international fora, whether it is the World Health Assembly or the UN General Assembly, and so on. And so we have started engaging parliamentarians in the network to share the campaign to join the delegation, their national delegation, to the World Health Assembly, upholding and explaining why it is important for parliamentarians to be there, to represent the voices of constituents in the global fora, but then also to have the necessary tools to hold our governments accountable once they go back to the national parliament. So This campaign was held for the first time last year, and we had several parliamentarians joining their national delegation to the World Health Assembly as a result of that. What we do to support parliamentarians, we help them with drafting letters to ministers and with all the process to get inside this national delegation. So here I had some questions, but I think I will leave them for when we see the UN General Assembly, because they are kind of similar and we can assess them all together. So another big event
Eleonor,
that, yeah.
Solo un pequeño comentario para traerlo a nivel regional. Aquí en Latinoamérica, cuando se dio esta campaña que señala Eleonor, que hizo Unite, enviamos cartas. Bueno, pasa esto que pasa también por lo que vimos en otras regiones, no solo en Latinoamérica. Hay poca comunicación entre el Ejecutivo y el Legislativo. Entonces, como contaba Eleonor, muchas veces las delegaciones nacionales a estos eventos, a reuniones de alto nivel, están integradas por muchos miembros del Ejecutivo, pero muy pocos miembros de los parlamentos. Y eso es lo que Unite está un poco tratando de revertir. Y acá enviamos cartas desde Unite, porque lo pidieron así integrantes de Unite, en Chile y en Ecuador, para contar dos casos. En Chile no nos fue bien, no logramos que los parlamentarios integren la delegación que iba a la asamblea, pero sí lo logramos en Ecuador. A partir de la intervención de Unite y ese pedido, se logró que una parlamentaria formara parte de la delegación. Después, bueno, por los eventos de Ecuador, que se disolvió la asamblea, no importa, al final esta persona no viajó porque no había más asamblea, pero eso es otra cuestión, pero había sido aceptada gracias a este pedido, con lo cual también para traer un caso exitoso, donde a veces quizás es simplemente necesario, bueno, exigir al Ejecutivo que el Parlamento forme parte de estos espacios.
Thanks, Anna, for this important comment. And on that, I would add also, but it's that from our experience, for some countries, the fact of sending a letter and supporting the parliamentarian into getting in the national delegation is quite successful, but then sometimes the executive doesn't pay for the person to travel. So sometimes there is no investment. So there is sometimes so the government accepts the parliamentarian in the delegation, but that doesn't provide budgetary support, which is another step that we need to go beyond. So yeah, but that's for the discussion. For the UN high-level meeting, I know Mariam also told you about it, so I'll just focus on the process and what Unite has been doing and how we can help. So you know that there is a General Assembly every year, and there can be an agreement to hold a special and exceptional meeting, which we call a UN high-level meeting, and it's done through a resolution that is passed from the member states. And for you to know, the first high-level meeting on health happened in 2001, and it was on HIV. Since then, there were high-level meetings on health already on UHC. There was one in 2019, non-communicable diseases, Ebola, antimicrobial resistance, and tuberculosis. Those are the topics that were already seen at the high-level meetings. So you see already that here there's a lot of things that are not being assessed: planetary health, mental health, etc., whenever the topics of high-level meetings. And we also already know what are going to be the next high-level meetings. So in 2024, it's going to be antimicrobial resistance, but in 2025, it's going to be non-communicable diseases. So this is already planned until 2025. Right, next slide. Okay, so as you already know, in 2023, we had 3 high-level meetings on pandemic prevention, preparedness, and response. This one was the first one. On universal health coverage, it was the second one because there was already one in 2019. And on tuberculosis, it was already the second one as well because there was already one in 2018. So there's a big difference between those 3 meetings. They were very different because Being the first declaration and the first meeting, it was a negotiation from scratch for the pandemic prevention, preparedness and response. And we know also that this is a very, very controversial topic in a political level, right? Because of the surveillance mechanisms, because of the equity with the distribution of vaccines and countermeasures, because of the IP waivers, etc. So it's a very, very controversial topic. So it was a difficult meeting to have, but it was very well attended. On the other side, you have tuberculosis, for instance, that is kind of a consensus between all of the countries, because countries have realized that to end TB, we need to invest in research and development and invest in innovation. So there was no such conflict in the debates, but it is hard to have member states, high-level heads of states, etc., attending the high-level meeting on TB, because it is difficult to put it in their political agenda. So challenges were different between the meetings. That's what I just covered now. In the process of the high-level meeting, this is a yearly process, of course, and there's one big milestone in May. So the high-level meeting is in September during the UN General Assembly, and there's one big step in May, which is the multi-stakeholder hearing. And this is a place where it is really important to be represented, and we need more parliamentarians there, because this is when the President of the General Assembly hears the stakeholders who want to take part in the negotiations of the political declarations and want to give what are their views on the topic. This year, we had 3 multi-stakeholder hearings, and we helped several parliamentarians within the framework of UNITE to attend these meetings and to be able to make statements from the floor, either at the multi-stakeholder hearing or at the UNHLM. We also did a lot of work with the missions in New York. It is really important to develop the work with them, because so they will be involved in the process for the year long, right? But sometimes depending also on the size of the mission, because for instance, I come from Portugal. The permanent mission of Portugal in New York is very small. It's only 3 people. So when they have high-level political declarations to negotiate in these kind of topics, it's very difficult for the permanent mission to have this role. So our role at UNITE and with our global health champions, and when we work with parliamentarians from the countries, is to also give support to the mission when it comes to the negotiating process. So, as you know, there were 3 political declarations. This is more or less what came out of it, but I know Mariam already told you a bit more about that. And so I was wondering if we could take some time now, just I will merge the questions from the World Health Assembly and the UN General Assembly, just to ask you if you were once, or the member of parliament you work with, were already part of a national delegation once. What was the experience, and if you would like to attend the UN high-level meetings or the World Health Assembly for next year, and if you would like UNITE's support to work on this.
Gracias, Eleanor. Podemos esperar un segundito, que quizás Sol pasa aquí en el chat a español las preguntas, pero creo que bueno, son claras. Si ustedes como parlamentarios, quienes son parlamentarios o quienes trabajan con parlamentarios, alguna vez formaron parte de esas delegaciones nacionales que, como decimos, las integra mucho el Ejecutivo, muy poco el Legislativo. Marcela, quizás desde tu experiencia, diputada Campañola, desde tu experiencia como diputada, quizás podés contar un poco, bueno, si los invitan, si no, ¿qué pasa con esa relación entre el Ejecutivo y el Legislativo en Argentina, en tu opinión? Y tenemos también las manos levantadas de Fabiola y Claudia.
No, la verdad que no nos invitan, por lo menos al resto de los diputados, tal vez algunos realmente invitan a los que están más relacionados con el oficialismo muchas veces. Pero, como lo dijeron los otros participantes, vengo trabajando en el sistema de salud mental hace muchísimo, jamás, pero nada, y es público que estoy trabajando, no es que lo trabajo en soledad y nadie lo sabe, es decir, hemos organizado con el senador Fiat jornadas, 3 jornadas, vinieron muchísimos especialistas de todas las miradas, pero bueno, es todo a pulmón, no hemos tenido, no hay delegaciones, es decir, no solamente en temas de salud, en diplomacia parlamentaria tampoco, no se constituyen los grupos de amistad, es decir, falta mucho desde lo legislativo trabajar los temas con las otras organizaciones internacionales.
Gracias, diputada. Eleonor, no sé si quieres acá tomar o escuchamos las otras respuestas y después respondes a todo.
Yeah, I can answer everything at the end.
Ok. Fabiola. Fabiola, ¿querés intervenir? Sí.
Hola, ¿qué tal? Buen día, Eleonor. Sí, yo un poco coincido con lo que manifestaba Marcela. En realidad nosotros tenemos una gran deficiencia en el Congreso argentino con el tema de la diplomacia parlamentaria. También por nuestro sistema de gobierno, a ver, el Ejecutivo puede invitar, convengamos que lo puede hacer, pero no tiene la obligación. No nos debe hacer, o sea, no tiene un deber de hacerlo. Lo mismo que cuando nosotros nos dirigimos como Congreso de la Nación al Ejecutivo, nosotros no les damos órdenes a ellos, no les podemos exigir que hagan tal o cual cosa, sí le podemos recomendar, pedir, solicitar, sea el gobierno que sea el color que sea. Otra cosa más, el Ejecutivo, y sí, tienen esta cuestión de que los distintos ejecutivos a lo largo de estos últimos 40 años normalmente han llevado a las delegaciones internacionales gente de su propio partido o parlamentarios de su propio color político, pero bueno, es una facultad que tienen de poder hacerlo. Está bien y no sé, o sea, pero sí está permitido y es legal lo que están haciendo, pero nosotros también, y en esto creo que es una especie de mea culpa como Congreso de la Nación, nosotros está dentro de nuestras facultades participar en distintos tipos de actividades internacionales y destinar presupuesto para eso sin depender del Ejecutivo, pero no lo hacemos. Nada más.
Gracias, Fabiola, por el comentario. Claudia, ¿querés contarnos? Creo que no te habías presentado, ¿no?
No. ¿Qué tal? Yo soy Claudia Medina, soy segunda secretaria de la Embajada de Paraguay en Montevideo. Estoy aquí hace varios años. Bueno, yo estuve anteriormente, yo trabajé ya para el Poder Judicial, estoy trabajando ahora para el Poder Ejecutivo, nunca trabajé en el Legislativo, no sé cómo funciona, para mí esto es un mundo absolutamente nuevo. Pero sí he estado en la misión de Paraguay ante la OEA, por ejemplo, ¿verdad? Que donde teníamos la PAJO en Washington, ¿verdad? Y jamás nosotros recibir parlamentarios para la PAJO no existía, o sea, o para la OEA, no es algo que hace nuestra diplomacia. Seguramente la diplomacia paraguaya es muy celosa con el Ejecutivo, pero nuestra Constitución dice eso, ¿verdad? Que las relaciones internacionales las lleva el Poder Ejecutivo. Entonces, es más, cuando yo tomé esta clase, esta diplomatura, mis compañeras me dijeron, diplomatura en diplomacia parlamentaria, o sea, no les gusta para nada, o sea, no, es un tema que para el diplomático es exclusivamente del Ejecutivo, si bien sabemos que tienen sus atribuciones que las da también la Constitución, ¿verdad? Pero de ninguna manera, o sea, yo no estaba en la misión de Paraguay ante la ONU, pero que yo sepa, no hay un mecanismo, digamos, de incluir a los senadores dentro de eso. Supongo que también, como estaba diciendo Fabián, la verdad es un tema también de que no presiona al Parlamento, porque si lo hiciera, nadie le dice que no parlamentarios y no nosotros funcionarios diplomáticos menos, ¿verdad? Lo único que nosotros tenemos, yo estuve trabajando hasta hace un mes atrás en la representación de Paraguay ante ALAI y Mercosur, y ahí nuestra experiencia era con el Parlasur, pero ni siquiera hay tanta conexión con los parlamentarios del Mercosur, es llevarlos a las reuniones, participar, hacer un informe y chao, o sea, hasta ahí llegamos. Bueno, quería contar esa experiencia, ¿verdad?
Claudia, gracias. Interesante por traer la experiencia de Paraguay y también por traer la experiencia desde alguien que está trabajando para el Ejecutivo. Así que bueno, nada, una voz más que valiosa. Julio.
Sí, no, Eleonor preguntaba si habíamos participado en alguna de las delegaciones en alguna oportunidad. Me parece un tema muy, pero muy interesante. En mi caso particular no he participado, pero sí, quizás en un futuro me gustaría, si tuviese la posibilidad de ser diputado de la Nación, participar, obviamente, en la delegación argentina. Pues es un tema muy interesante. Y no hay que perder de vista, para fortalecer un poco lo que decía Santiago, el tema de las comisiones, que es verdad, este año han trabajado poco, tanto en la Cámara de Diputados como en el Senado Nacional. Estamos pasando por un proceso eleccionario en la República Argentina y eso hay que tenerlo en cuenta también. Pero bueno, más allá de todo eso, me parece que es muy, pero muy importante resaltar de que, por ejemplo, tanto los miembros del Poder Ejecutivo que pueden ser citados por el Parlamento para que asistan, también hay que resaltar de que se puede hacer un pedido de informes al Poder Ejecutivo. Y quería traer simplemente este detalle porque me parece importante. En el Parlamento Argentino, Cámara de Diputados, hay un proyecto que es el expediente 3.946 de este año 2023, que es de la diputada Campagnoli, en la cual hace un pedido de informes al Poder Ejecutivo sobre presupuesto y ejecución de los programas de salud mental y adicciones. Entonces, la diputada en este caso ha presentado un proyecto solicitando un pedido de informes, o sea, que se informe. ¿Y para qué? Para que después el Congreso Nacional le pueda informar a la sociedad. Entonces, volvemos siempre a lo mismo. Si el representante elegido por el pueblo no le informa al pueblo lo que tiene que estar trabajando, estamos en un grave problema. Entonces, fortaleciendo lo que decía Santiago, no se están haciendo reuniones de comisiones, y es verdad, pero bueno, me parece que de todo esto hay que ir aprendiendo y hoy los diputados electos que van a tomar juramento en el mes de diciembre, me parece que tienen que tomar muchísima atención de todas estas cuestiones para trabajar a partir del nuevo periodo legislativo en el mes de marzo. Gracias.
Gracias, Julio. Bueno, creo que no hay ninguna otra mano levantada, así que Eleonor, adelante.
Thank you all for your comments and very valuable inputs and questions. Just maybe very quickly to say that it was considered, it is written in one of the resolutions of the World Health Organization that they incentive governments to integrate parliamentarians in the delegations, but it is not mandatory and it's for now just a resolution. But it has been, you know that the Director General of the World Health Organization was a parliamentarian before, Dr. Tedros, and since he started working as the Director of the World Health Organization, he has pushed a lot for the World Health Organization to work more with parliamentarians. So for instance, at UNITE, we work directly with the parliamentary engagement officers of the World Health Organization, but they didn't exist before Tedros took the mandate of Director General. So this is a work in progress. I think a few years ago, parliamentarians were not even considered, even by the international organizations, as important stakeholders to be present in these discussions. Now there are more and more. There is a resolution, and we know that there are discussions being held on maybe trying to I'm not sure this is so possible in the very close future, but to try to structure a little bit more the delegations and say to each member state, look, we would like to see in your delegation members of the government, members of the parliament, but also representative of the youth or of vulnerable populations, or, you know, there's a lot of things also to do for the delegations to be more complete and more the representation of the state. So these are things that are being discussed, but of course you can understand that it's very difficult for an international organization also to go and see a government and ask for them to build the delegation in a way or another. So this is all about diplomacy, but it's a lot in the minds and especially of the World Health Organization to work more with parliamentarians and so to structure these delegations that way. And maybe another comment on the fact that when we started at Unite, being a global parliamentarians network on global health, with all the international organizations we work with, at the beginning we had to explain why we were working with parliamentarians. So when we worked with the Global Fund, with CEPI or Gavi, the Vaccine Alliance, or even the World Health Organization at the beginning, we had to advocate, you know, to explain, no, you should work with parliamentarians because they are the representatives of the constituencies, because they have their word to say in budgets, because they legislate, and because they hold governments accountable. And so we would always come with this narrative of why it was important to work with parliamentarians, because I don't think it was so natural for these international organizations, because they see parliamentarians more as actors at the domestic level, at the national level, right? And maybe parliamentarians is also feel that way. So so it was not so automatical, and now it's more and more. And for instance, at the multi-stakeholder hearings this year in New York in May, it was said several times by missions and by people who did statements that they recognized the presence of parliamentarians in the room, that they have never seen so many parliamentarians in the room, and that we need to work more with parliamentarians. So that was a big win also for all of us here. So yeah, that's the... Oh, I see a hand raised. Verónica.
Sí, ¿cómo estás, Eleonor? Lo que yo digo que por ahí a los organismos internacionales prefieren por ahí a los ejecutivos porque parece que las decisiones que se adopten o los acuerdos pueden ser más expeditivos. La diferencia está que los acuerdos que se adopten con los parlamentarios, como por ejemplo en nuestro país, en nuestro marco normativo, son los que definen las políticas públicas. Estas políticas públicas que se acuerden con organismos internacionales pueden ser mucho más sólidas, consistentes y tener el grado de legitimidad de involucrar una pluralidad de representación, porque hay miradas de los distintos espacios políticos, y eso en algún punto garantiza una mayor sustentabilidad de las medidas que se adopten, porque se sabe que están miradas desde una mirada más integrada y que entonces pueden tener la posibilidad de atravesar los distintos gobiernos y no son privativas de un espacio político en particular, ¿no? Eso quería.
Thank you for your comment, and totally aligned on. I think it is easier to go directly to the executive, but it's more sustainable also to have the support of the parliamentarians. If you don't mind, I can go through the other points also, because I think we're almost at the end of the class, so I can accelerate a little bit. What I wanted to tell you about also a little bit was the pandemic accord, but I know I've seen that Mariam has already said a lot about it. Just to let you know that there are two parallel processes being held at the moment, which is the pandemic accord and the international health regulations being amended. This process is driven by the need to ensure communities and governments and all sectors of society actually are better prepared for the next pandemic. And we already have a zero draft for the pandemic accord, and we expect an approval for the end of 2024. The big topics of the pandemic accord and where there is a lot of debate, there is a focus on global cooperation. We don't want, like with the COVID-19 pandemic, countries who are desolidarizing, I don't know how to say that in English, but are not being in solidarity with the global community. So this is the first thing that we want to tackle. The strengthening of health systems, of course, because health systems, and especially primary healthcare that works well in a country, is already a big step for pandemic prevention. Equitable access to diagnostics and treatments, of course, investment and research and development for vaccines, for therapeutics and countermeasures, transparency in sharing information. This is a big concern, and this is where there's a lot of discussions because, you know, with the pandemic, the COVID-19 pandemic, there were some criticisms for countries who did not share the information soon enough, but also some countries who shared the information very soon and who we could say that they behaved well, like South Africa, for instance, who was really the first always to say when there was a variant and a rise of cases, etc. And then all the flights were cut to the country. So we have to find, it's very difficult, but the international community has to find a way to incentivize countries to share information and not, let's say, punish them in some way, as we have seen in the previous response to the COVID-19 pandemic. There is also the pathogen access and benefit sharing system and addressing gender disparities. And there's also the IP waiver, which is a big also discussion, you know, on intellectual property. Once there is a big investment in research and development for vaccines, do we share the knowledge? Do we not? How is it shared? Is it transparent? This is also a difficulty. As I told you before, we are a relevant stakeholder to the negotiations, so we are part of the negotiations. We do have written inputs and oral inputs to the process, and usually when we do it, we ask for the network before. So we go to the 500 members of parliament we have at Unite, we ask them for their opinion, and then we synthesize that, and we go to the INB and we say what the network has to say about it. I had here some questions, but I will leave them to the end because they're interesting as well. It's on the pandemic accord, and I will just try to wrap up very quickly.
Eleonor, solo una cosita. Para comentar, Eleonor ya sabe, pero lo comento para todos aquí, que cuando hicimos este curso que les contaba más breve, el austral, entre mayo y junio, en relación con temas de salud global, que fue un curso como extra que da Unite, no me acuerdo el nombre formal, por eso les estoy diciendo curso corto, curso extra, ya me va a venir el nombre. Pero cuando hicimos ese curso, justamente lo que salió al hablar del Pandemic Accord fue que, o del Tratado de las Pandemias, como se dice en español, que casi no había información en Latinoamérica cuando es algo que, como dice Eleonor, no falta mucho para que se apruebe, falta tampoco no mucho para que vaya a tener que ser ratificado o no por los congresos y no llega información. Es todo un poco la falta de transparencia de cómo se lleva adelante el tratado quizás, pero también la poca, vuelvo al tema de la comunicación que ustedes vienen trabajando y porque apareció mucho en ese curso, que también era un curso destinado a parlamentarios y staff de toda Latinoamérica, no solo en Argentina, no había información de este tratado que ya está en la etapa final de su negociación y su aprobación. Solo eso.
Yeah, exactly. And, you know, maybe what I will do is that I will leave this slide with these two questions because I think they are more important, and I will just update you on the two last things very, very quickly so we can go back to this topic. The two other main global events I mean, there's one global event and then one tool that we work with at Unite and that I wanted to present you as well, was the Global Summit, so the World Health Summit. Every year, there is what we call a World Health Summit in Berlin. This is very private sector, pharma industry, etc. led, but there's also a big representation of academia. It is a scientific event more than a political one. And we at Unite, we help parliamentarians also to have access to this event. This one is more easy because there's no national delegations or whatever, it is just a meeting. And it is important for us to go there every year to know, so to also help parliamentarians having access to a more technical information, right? From scientific community, academia, but also from civil society. So the World Health Summit is always at the end of October, and it's in Berlin. And for next year, Unite also has a global summit, a yearly summit, and Anna can give you all the information if you are interested in joining. You're of course all invited to come. And next year, this global summit of Unite will be held jointly with the World Health Summit. So there will be 3 days of World Health Summit in Berlin, and then an additional day of the Unite Global Summit, where we invite all parliamentarians to come. Parliamentarians will have access to the whole World Health Summit and then to the debates of the Unite Global Summit. So that's another moment. It's at the end of October, and we have plenty of time to discuss it together, and Anna can also help you and give you more information on it. And the last thing I wanted to also mention, and Mariam also touched upon it a little bit, are the global health subcommittees. As she said, there are some global health subcommittees out there in the world. The first one was created by a member of parliament in Germany, and maybe what I can say in a more kind of personal experience, because I have worked a lot with this member of parliament, Andrew Woolman, and the Global Health Subcommittee. In Germany, the Global Health Subcommittee exists since 2019. And it is very impressive to see a group of, I think there are 6 members of parliament inside of the group. They are really very specialized in this area, and so they get work done much faster than if this group was not existing. It's very impressive to go to parliament and to talk to a group of members of parliament who are really aware of these debates, and they follow really closely the work of the World Health Organization, etc. And they are a very good bridge between the national debate and those international organizations, because it's very hard for the World Health Organization to come to parliament to host a hearing or a session. But if you have a committee that is specialized on discussing global health topics, then it is a good entry door, both for organizations into the national level debate, as also for the parliamentarians to get to know a little bit more about what's being discussed at the global level. For instance, the Global Health Subcommittee in Germany, they discussed a resolution in May around the World Health Assembly, more or less time frame. They discussed a resolution that stipulates that Germany supports the increase for access contributions of countries to the World Health Organization. So they have also the power and the space, to work on this kind of resolutions and to present to parliament. So it's a very interesting tool. There's also something else that some countries have, which is a global health ambassador. And this is a person who is the ambassador for global health for the country. Sometimes it's a person from the Foreign Affairs Ministry, sometimes from the Health Ministry. It depends on the countries. But it's also something really interesting to carry also the voice of the country at the global health level. And so, finishing on that, I can go back to the pandemic accord, to those really important questions, because I think those are the main questions for the next year, because the pandemic accord will be adopted in May. And so how how are the countries going to ratify this treaty? And Anna was mentioning that there is no information, so I want to turn to you to understand, is there information? Were you aware of the negotiations of the accord? Is there a dialogue between the executive and the legislative on that? Are there informations that you need? And we at Unite can help you because we are following the discussions. We have several briefings that we can distribute. Either it is on the procedure or on the content of the pandemic accord, and we can answer all your questions. So yeah, that's I think a good debate to close the class.
Gracias, Eleonor. Bueno, entonces esperamos saber qué contribuciones hay. Por supuesto, espero que me den la razón. Ahora ya veo que todos dicen que hay muchísima información sobre el tratado de la pandemia y estoy en problemas.
No, mira,
Adelante.
yo puedo hablar, que no encuentro acá No, mira, no hay información y esa falta de información contribuye a generar resistencia, porque ha habido información como muy o sea, difundida a través de los medios, pero por ahí no es la información fidedigna del contenido del tratado. Entonces, ¿qué nos ha pasado? A nosotros hemos recibido en el mail institucional del despacho del senador muchos mails que mandan gente o sea, organizaciones de la sociedad civil que hablan de que esto podría generar como entregar la soberanía a la Organización Mundial de la Salud, que el acuerdo pandémico puede imponernos restricciones. Entonces me parece muy importante esto de difundir información confiable, certera, completa, para que se conozca bien. Vivo en un primer piso, el ruido.
Gracias, Vero. ¿Alguien más que quiera compartir quizás la experiencia desde sus despachos o como parlamentarios directamente? Sí. Respecto de la información o la falta de ella, o como señala Vero, ¿no? ¿Qué llega a los despachos? Porque a veces llega información, pero no es la información quizás más objetiva o de cómo se está dando ese proceso de negociación. Después, obviamente, puede haber diferentes posturas sobre el tratado de las pandemias, más allá de que uno tenga la información correcta, pero ¿alguna otra experiencia en relación a este tema? No, no es un tema que ni aparece, me parece. Eleonor, ¿querés comentar un poco sobre lo que señala Vero de la información, de la falta de información o la sobreabundancia de información muy parcial sobre el trato de las pandemias y cómo eso llega a Unite, o qué está haciendo Unite en relación a eso?
Sure, Anna, thanks, and thanks, Veronica, for sharing the experience. Last year, our president, Ricardo, was at the spring meetings in Washington, and there was a session with a lot of parliamentarians in the room because it was the meeting of the Parliamentary Network of the World Bank and IMF. So there were more than 200 parliamentarians in the room, and he asked them if they were aware of the pandemic accord process, and nobody raised their hands. There are a lot of people out there, a lot of legislators and policymakers who are not aware, and they will only get the information once the treaty is adopted and it will be tabled in Parliament for ratification. And at that moment, it's going to be really hard to ratify because there's a lot of misinformation. And the only information that circles around this accord are these things that you mentioned, Veronica. So the loss of sovereignty and all these kind of things. But not only it is important to communicate with the members of parliament, it is important to communicate with civil society and the citizens, because if the communities don't agree on the accord. I know that I've been speaking, for instance, to a member of parliament in the UK, Philippa Whitford. She works a lot with us, and she said, I receive emails nearly every day from my constituents prohibiting me to ratify the accord because they don't want to, and they have all this misinformation around. And so she's so she's not aware of the debates, she doesn't have the information, but even more, she has the pressure of the citizens who don't want her to ratify the accord. So here there's a big work of information and communication to be done. It has to be done by the international organizations also who are working on it. So we rely on the World Health Organization to be transparent in the process and to open the doors to more stakeholders, to be really more transparent about the process itself. So yeah, it's a big issue. We try at Unite the most we can to raise awareness of parliamentarians on this pandemic accord. We did a lot of workshops. We had a hearing with the international negotiating body at the Interparliamentary Union General Assembly last week. So we do a lot to raise awareness, but there's a lot to be done still. So yeah.
Bueno, muchas gracias, Eleanor, por la respuesta y por la conversación. ¿Alguien más que quiera hacerle alguna pregunta a Eleanor sobre este tema del Tratado de las Pandemias, sobre alguno de los otros temas de las reuniones de alto nivel que ella trabajó y la participación de los parlamentos en esas reuniones? Bueno, si no hay más manos levantadas, entonces, bueno, quería agradecerle a Eleanor por su presentación y también por, bueno, haberles dado la palabra a ustedes, ¿no? En esta cosa interactiva que sé que Juan de Dios desde el Austral favorece mucho, que es que los cursos tengan profesores, pero que también haya una participación activa de parte de los estudiantes. Así que gracias, Eleanor, por hacer el espacio, porque no siempre, y Mariam también, no siempre los profesores y las profesoras nos hacen caso de hacer hablar a los estudiantes, que es interesante también porque ustedes están trabajando todos los días en los parlamentos. Entonces, hay muchas cosas que podemos decir desde Unite, pero si no los escuchamos a ustedes, ¿para qué somos una red de parlamentarios, ¿no? Así que bueno, les agradezco mucho. Ya el viernes que viene van a tenerlo de nuevo a Juan de Dios, que estará finalmente de regreso desde la asamblea de la IPU. Así que lo van a tener de nuevo y no en un avión. Espero haberlo reemplazado más o menos dignamente. Y bueno, gracias, Eleanor, lo mismo que le dije a Mariam, por dedicar tu sábado a la tarde. Ya es tarde donde vive Eleanor y está acá con nosotros. Así que muchas gracias por dedicarnos este rato. Y bueno, gracias a ustedes por participar de las clases que estuvieron a cargo de Unite. Y nada, los espero sus correos en mi mail para tener más integrantes de Unite en la región. Gracias a todos y buen fin de semana.
Gracias, Anita.
Gracias. Buen fin de.
Gracias, buen fin de.
Thank you.
Chao.
Bye.